Hello, good morning, good afternoon, and good evening, wherever you are. Welcome to our next episode of Masters of Product. Our topic for today is the impact of AI on home healthcare services. And to help us dive deep into this topic, I have Ravi Bellur. He's the CPO and CTO at Home Health Care. He has over 2 decades of experience in product. Finally, I found somebody who has the same number of experiences I do. uh, he has 2 decades of experience in product, technology, and digital transformation before he was a CTO at Clean Harbor. Ravi and I connected on LinkedIn probably about a few weeks ago. And when he was talking to me about the impact of AI in healthcare, I said, Ravi, you have to come on the podcast. So I'm so glad he's here to join us. As for me, my name is Mustafa Kapadia. I'm your host. I also help product teams figure out how to use AI to be more effective and efficient. You can learn more about me and my services at echo-point.com. Ravi, welcome to the show. Thanks for joining us.
Mustafa, thank you so much. I appreciate this conversation, important one at that, and I'm glad to be talking to you and the audience.
Perfect. I'm looking forward to it. And by the way, we have quite a few audience. So if you're listening in, please drop in where you're from. We would love to know which part of the country or the world you're in. And by the way, this is a LinkedIn Live session. One of the benefits of LinkedIn Live is that you can actually talk and ask questions to both Ravi and myself. So number one, introduce yourself, tell us where you're from, and then ask us lots of questions. Those are the best kind. Ravi, if it's okay with you, let's start with the top, because one of the things when we start talking about is like healthcare is such a important, vital industry, but it's also very complex, and there's lots of different places. Depending on where you are as a patient or a doctor or a consumer, you can have very different experiences. Why not, if it's okay with you, why don't you lay out the land of where you see healthcare is, and then where does your company fit into the whole process, right? And maybe you can share a little bit about your company as well. So.
Sure, absolutely. Thank you, Mustafa. Let me first talk about BAYADA.com, BAYADA, and I would urge the audience to go to BAYADA.com. We are a premier provider of various healthcare services, probably the off the top three, if you will, in home healthcare across the country. We are, of course, I must correct that, we are, of course, in 24 states. So for any of you out there who are seeking any type of clinician services, any type of private pay services, rehabilitation, I would urge the audience to go to BAYADA.com, look up the locator service, and I'm sure we would be of service to you.
Perfect. And by the way, welcome Hitesh. Thanks for coming from Toronto. And Tom, thanks from Arizona. One of my favorite places, by the way. So,
yeah.
Sorry, please, Ravi, continue.
Let's start, Mustafa, at the top, kind of provide the overall landscape of healthcare in general, and then we'll go specific into home healthcare or any other topic that we want to go into tangentially. The way I would describe healthcare is like a 5-layered cake, right? Look at a large cake, and there are various layers to it. And so if you look at the bottommost layer, it's the financial layer.
Nice.
The U.S. economy is about $28 trillion. And if you look at how the pie of $28 trillion is split apart, it's like probably four major categories.
Nice.
The one, of course, is healthcare, which is about $4 trillion. So about 18 to 19% of the economy. Then you have the services industry, which includes consumer spending, which is like the biggest part of services industry, which is about, I think, 22, 24%,
right,
depending on how that goes. You then have retail and construction, right? Real estate and construction, right? That's about under 20% of the economy. And the remaining almost 24, 25% combined is the federal government spending, right? Which is everything under the sun that we spend on. So if you look at that pie, let's zone in on the $4 trillion.
Yes.
So of the $4 trillion, $1 trillion is direct consumer spending in healthcare.
Got it.
That is you, me, spending money, buying drugs, any direct spending, vendors, suppliers, you name it. About $1 trillion. The next $1 trillion, roughly, is employer-provided healthcare.
Hmm.
Many of us who are employed, right, in various services, our employers provide healthcare. So that's about $1 trillion, and there's an interesting history to that. If we have time, we can deep dive into it.
Yeah, please. Yeah.
The other $2 trillion is essentially federal government spending, which is in the form of both Medicare and Medicaid.
Yeah.
And they are managed by CMS and Department of Health and Human Services, which is a parent body. So in a broad nutshell, that's like the first layer of the cake, the financially
Right.
how the whole ecosystem is organized.
Right. Awesome.
The second layer of the cake are the institutions. Let's look at who the major players are within the healthcare space. You obviously have the big insurance companies, which are
Right.
also known as payers. You have the federal programs, Medicare and Medicaid services, the biggest of them at least. You then have the various service providers, right? These are your hospitals, these are your urgent care clinics, your primary care physician chains, home health care services, which I
Right.
belong to. BAYADA Home Health is part of that. Dental clinics, you name it. These are all the various service providers that are available. And then, of course, the third or fourth segment in the institutional players is the pharmacy sector, which is a complicated beast of its own. We'll leave that
Yeah.
aside for a minute. We might need a complete session just to discuss. Right?
I agree.
So that's layer number 2.
Yeah.
Five. Layer 3 are who are the individual personas. So both of us are product people. So we tend to deal with personas, right? When we look at products, who are the personas? You have the caregivers, the clinicians, right?
Yeah.
Health aid workers, OTs, PTs, who provide the valuable service that whether it's in the institutional or at home, they are the ones who remove friction from this whole ecosystem. You have the doctors or physicians. You also have the administrative staff. And by the way, I might also add that of the 4 trillion, administrative cost in healthcare is about 15%. That's almost $600 billion in administrative cost, and that has risen from being 4% in the 1960s to 15% now. So when we talk about AI and the potential for AI purely in terms of reducing administrative costs, there's a lot to unpack on where that can be applied, right? So those are some of the individual players, if you will, and there are a couple of angles here we can explore. And one of the key challenges with healthcare, as you know, Mustafa, is cost, right? The cost of healthcare is constantly rising. There's also a demand-supply imbalance.
Yes.
Healthcare today. There's a supply side constraint that has emerged in the United States, right? There's constant demand. Our population is aging. And by 2035, by certain estimates, we'll have more people over 60 years than they are under.
Yes.
Right. And combine that with more hospitals closing than opening, you have a significant constraint on the supply side. And that's where home health starts to become a bigger and bigger attractive option.
And more convenient for many folks.
And more convenient for many of us, right? So layer 4, and I'll stop after layer 5 to see how we unpack this. So layer 4, let's briefly talk about regulations. How did this come about, right? All this ecosystem we just spoke of. How did this come about? It really starts in the early 1950s, around 1954, when the first laws around employer-mandated insurance were codified. That's when almost 70 plus years back that we have been having employer-provided insurance. So that's the first one. 1965, we had Congress passing Medicaid and Medicare along with other landmark acts here, right? Civil rights and all of that. So Medicare, Medicaid comes into play. Then fast forward 30 years, mid-90s, we have HIPAA come into play. So around mid-96, 97. So HIPAA really governs how we manage everything within healthcare. Right? So again, we can talk a little bit about that given time constraints. And then the last piece of legislation that is of importance to us is around the year 2000, Congress enacts the law that allows managed Medicaid and Medicare Advantage, which is the part of the federal government spending on Medicare and Medicaid, to be managed by private insurance players. And that's what's growing in size slowly but surely over several years. So that's just a rough overview of the regulatory landscape, right? And the last part of that cake, if you will, is more a choice the US as a society has made, which is unique. It's unparalleled around the world in healthcare, which is around access and choice, right? Access in terms of the fact that you'll never have to go beyond a county to reach some kind of facility which provides healthcare services, whether it's a hospital, urgent care, you name it. So the society has made a choice that we will provide access at any cost.
Yes.
And then we've also made a choice as a society that we will provide choices, right? So look at the number of interventions that are possible today. Like, we treat almost the type of lifestyle diseases that we treat, it's unparalleled in the world. Nobody else does that. The type of choice of drugs is, again, unparalleled. The amount of research that happens here, nowhere else in the world, right? Even the choices of insurance players, right? You can argue that point a bit, but we have made a conscious effort to index on access and choice. And that's one of the contributing factors towards rising cost. Let me pause here. And I know there is a lot of things on the plate, and see where you want to go next.
No, I think that's great. And thank you for that layer, because you're absolutely right. I think describing all the layers helps build into context the complexity of what we're dealing with and all the different incentives and agendas that each one of the layers has and the players within within those layers, which makes the transformation all the more harder to do, right? We do have two more people join. Shirley, apparently Shirley knows you, so she's saying, good to see you, Ravi. And then, of course, Raji joined as well, so thank you. And if there's others who join us, please let us know. Drop us where you're from. And by the way, feel free to ask Ravi or myself some questions as we go deep. Ravi, if it's okay with you, let's go narrow, right? So I think the 5-layer cake analogy works. But if you kind of talk about just your industry, and you talk about home healthcare, and especially the way you laid it out, saying that, you know what, as access becomes harder and harder, home healthcare becomes an easier option, right? So if you just play with that trajectory, why don't we talk about where do you see AI actually helping you within your industry itself?
Great.
And if you can get even more specific use cases,
yes,
that would be great. And then I know we actually have another question, so why don't we start with that question, and then we'll go back to our LinkedIn user. I think this one is there's no name. It might be Hitesh. So Hitesh, will get to your question soon.
Sure. Yes. So let's talk about AI and its impact on home healthcare specifically, but obviously the context applies to healthcare in general as well. It would be necessary to briefly lay out, and Mustafa, we might have to do this superficially because otherwise this is like a 4-hour discussion.
Yes.
An explanation of what the various workflows are, right, in home healthcare. So if you look at how a business is administered and the business of providing service and care at home is administered, you have to understand that there are about 6 to 7 major workflows. It starts at the front end with a recruitment workflow. And remember, I'll go back to the thought about supply-demand imbalance, right? Having a pool of talented, skilled, committed clinicians, OTs, PDs is extremely critical for our ability to manage care at home. So the recruitment workflow is the first step in the process.
Got it.
You then have what is known as a referral workflow. And referral is nothing like a doctor referring you to a specialist. So similarly, in home healthcare, a hospital system would refer patients, and we call them as clients, into our system. And there's a sort of complexities in how information is now exchanged about their prior history, their vaccination,
Trust me, we have to jump through referral. I think everybody's gone through referral hoops to know how
There you
complicated.
go, right?
Yeah,
So you have the referral workflows.
yeah,
You then have core clinical workflows. This is where you have the actual interventions being administered, and we'll talk a
right.
little bit about that. You then tend to have operational workflows. So I think this is one of the hot spots where there's a lot of bottlenecks, where I think we can dive in a bit deep on what AI can do in that space.
Yeah,
Classic example of that is, let's say you have a client or a patient and
right.
you have a vacant shift that you have to match, and
Yeah,
you have a caregiver that you need to sell, a pool of caregivers that you would need to select from. Now, just like anything else, think of eHarmony, right? There are preferences on either side,
yeah,
right? And if your client is a child, mom would have a lot of specific conditions on
of
who gets
course.
to enter
Yes.
the house. So having the ability to operationally match a client, a patient, and a caregiver is a
Yeah,
complex task.
yeah. The matchmaking, I 100% agree. Yes.
Matchmaking, and then you have to call the caregiver, you have to call the mom, you have to schedule the service, you have to make sure you
Yeah,
do a care plan. These are all opportunities. There are complications too, opportunities for agentic applications of AI in the future, right? So that's operational workflows there.
yeah.
Then you have, I think, where the biggest bang for the buck lies, which is revenue cycle management.
Hmm.
RCM, it's in healthcare language, it's called RCM, but it's the entire functions ranging from generating a claim,
Right.
getting all the data from the care that was administered, making sure you have the eligibility and authorization available, and you are then going to take that claim and file an invoice, create an invoice that has to be sent to a couple of groups within home healthcare. This does not necessarily
Yeah.
apply to the hospital system. Home healthcare has some additional mandates called visit verification, electronic visit verification.
Got it.
And the states and the payers mandate that we track geolocation of where the care is administered.
Oh, wow. Okay.
So that gets tracked. And then you have to attach that to your claim, make sure it's a legitimate service we provided,
Yeah.
right? And then you have to file the claim. You'll have to negotiate with the payer. They'll ask for more data. You'll have to adjust the claim. That's a hotspot area where you can have significant potential for AI in the future.
Yeah.
And of course, last but not the least, you have like other workflows like payroll and
Of
such.
course.
So if I can sum that up back, we have what is known as a refer to bill system, right? This is
Yeah.
how healthcare is administered, is in a refer to bill system. And you then have to evaluate saying, okay, what are the hotspots? And AI application really around scheduling, visit management, and in RCM could be two potential hotspots. And the one that is more generic across healthcare, not necessarily home health, that is a pet peeve of
Yeah.
almost every clinician in the country is documentation, right?
Hmm.
When you went to your primary care, if you remember, he or she would be sitting in front of a computer, documenting care as they were speaking to you or
Yeah.
soon afterwards. It is the amount of time that is spent on documentation is
Yeah.
significant across healthcare. So capabilities like ambient listening,
Yeah.
Microsoft and other companies are coming up with so many AI enabled ambient listening capabilities, generative AI that summarizes care that was
Yes.
administered. So those are some of the potential hotspot areas where AI has a chance of making a dent.
And that's I like that piece too. Um, Especially the workflows that you laid out. So if it's okay, let's pick a workflow that you think is rich for AI transformation, and maybe you can give some use cases about how it is. So definitely the ambient listening part is a good one. The other ones from the operations part in which you can actually do better revenue management cycles. I think those are good ones. Are they are there other areas or any specific use cases that you can think of that are of the workflows which are target rich?
Yes. So if you look at recruitment, right?
Yeah.
Let's look at referrals.
Okay.
Now, when you get referrals, right, these are patients or clients that you have to figure out, can I provide care as a home health agency? Can I provide care to this particular candidate? there are a lot of conditions you have to evaluate, right? You have to look at their history, their prognosis. You have to review their eligibility. You have to verify their insurance benefits. You have to make sure that you have the authorization for it. You have to coordinate with the referring agency
Right.
on the immediate actual history that has happened. You have to then figure out at the same time, are you able to serve in your office, provide service to this particular client? They could be in an area, in a
Right.
zone where you may not have coverage or have coverage. It's a lot of administrative manual work that is involved. So
Right.
bringing AI prediction capabilities, this is more
Mm.
classical AI, right? Predicting, okay, do I have the ability to provide effective and consistent care to this patient? And building up that history of and data and applying it provides us, right, with an ability to in fact increase the pipeline even more, because you're removing some of the constraints in the system,
Right.
right? You're able to serve more and more clients. We as Bayada, we serve about, I'm going to take some average numbers here, between 45 and 50,000 clients, right?
Wow.
Our in per week. Our the demand, as you heard, right, it's not going down. If anything, it's
No.
going to go north.
Yep.
So the issue that all home healthcare agencies have is, how do you increase that demand? How can we serve more clients? So AI has a fantastic opportunity
Yeah.
to speeding
Definitely.
the process.
Yeah. Um, we do have a question which is related to one of the use cases. So let me just put it up on the screen. And this came in some time ago. So thanks for being patient with us. But the question is, are current coverage structures, especially under Medicare and Medicaid, flexible enough to support AI-based monitoring and virtual care at home if we plan to implement such a solution for home healthcare, right?
So the answer is not, there's not a clean yes and no answer to that yet. Uh, the issue being, there is HIPAA, there is
Yeah.
other rules and regulations. There are states, various individual states that have bias regulations in place. So often you have to prove that the type of AI you're deploying doesn't have bias, for example. You also need to have internal governance controls that determine when you're going to deploy AI in
Right.
what ecosystem and setting. What you can do is, and by the way, just FYI, and this is a personal opinion I'm expressing, this is not my company's opinion, I just
Yep.
want to clarify this. The laws governing Medicare, Medicaid, and HIPAA were crafted before we even used cell phones,
Yeah.
right? So to expect AI, them to have AI friendly legislations
Yeah.
is not appropriate, right? The regulations have to catch up everywhere, and
Yeah.
that's the challenge within healthcare. But what we can do as professionals is look at, let's say, Medicare services. BAYADA also provides home health Medicare services,
Hmm.
or basically doctors' prescriptions. Again, documentation, right? Our nurses, our clinicians often spend an extra 45 to 50 minutes each day at the end of a shift sitting and documenting care.
Yeah.
In a car, sometimes it's
Yeah.
raining, or, so we don't have to wait for Medicare or Medicaid to tell us that. So long as we are able to subscribe and ensure we are following all the laws
Yeah.
correctly, we ought to be able to deploy certain AI capabilities in those areas.
I agree. I mean, the ambient listening piece, or having AI, quote unquote, be the note taker and fill out all the details, is fantastic, which allows the clinician or the doctor to just review it and then submit, right? So
Right,
you actually, and that saves a ton of time, right?
right,
I've
right.
heard that use case several times. I'm curious, in your organization itself, what are the use cases that you guys are pursuing, if you can share?
I'll share what I think I can share. There are a few things, obviously,
Of
I
course,
won't be
that's
able
why I
to.
said what you can share, because
Yes.
we all know what the secrecy around product. So
That's right. We obviously, documentation is one
yeah,
of those use cases that are top of the list. The other one is use cases around. So the way we work is we have various EMRs or EHR systems, right? And
okay,
our platform providers are investing heavily also in AI and scheduling and shift matching is an area where there's a lot of activity happening. Summarization of compliance. So, for example, when care is provided at home, the clinical manager has to make sure that we have followed all the internal
Yeah.
compliance guidelines. So, summarizing compliance details is another use case that we are pursuing. So, those are
Right.
just a small flavor that I can share. But I think our biggest challenge would be to focus on documentation. The one other area that we are focusing on also, again, is medical coding, right?
Oh,
So
yeah.
when you upload, let's say Medicare services, you have to upload all the documentation to
Yeah.
Oasis, which is our conduit.
And
And
put in the
so
proper code so you can charge the right services. Yeah.
that's right. And if there's an opportunity for AI, it's obviously in medical coding as well.
Yeah.
Today, medical coding is done by remote teams, and so there's a potential for us to automate much of that in
Yeah.
the future.
Yeah. And also there's been, at least from what you hear, is there's a lot of times in which sometimes coding is wrong. So that causes um,
Right.
pain to the consumer, right? To the patient.
Yeah.
And so if AI can help correct some of those mistakes, right?
Right.
I think that's good.
Right.
If you take everything, and by the way, our friends in LinkedIn, feel free to ask more questions, please. Um, Questions from the audience are the best questions. um, if you take about all of the use cases that you're thinking about, right? Uh, how is it going to, like, if you make all these changes, what's the benefit to you, right? What's the benefit to the person who is actually getting those changes? And I'm going to ask you, right? Um, just how do you measure that benefit?
Right. So it's let's take the way I would answer this, Mustafa, is we may need to take a step back because the assumption is that all organizations are 100% ready for AI, and the answer may not be that, right? Um,
Yeah.
if you look at healthcare as an industry, there are two or three um, major issues that
Hmm.
all of the organizations grapple with. One is data, right?
Yeah.
Because of the way PII and PHI is managed, there's a lot of islands of data. There's a
Yeah.
data mastering aspect to the how data moves across systems, and that leads to the second aspect of data, which is interoperability. Right?
Yeah.
You have significant interoperability issues not only within various companies but also across organizations exchanging data. So there's a, and the third aspect of healthcare systems, unlike other domains and industries, is again, I'm going to make a generalized statement here.
Right.
This may not be specific to any particular company.
Yeah.
A lot of companies, and to be candid, this is applicable even to companies outside of healthcare. There's a significant level of technical debt
Oh, yeah.
that prevents forward mobility in deploying capabilities like AI.
Yeah.
So, one of the first things that I think each of us as professionals and AI enthusiasts needs to do is look at how organized we are in terms of AI, data,
Yeah.
technology, and governance. Right? You need a formal
Yes.
process of governing AI.
100%.
Right?
Yeah.
So, I think once you are past um, those situations, then you can start to put in uh, various mechanisms to see how you would generate value from AI. So the way that I would do it is you look at an income statement of any company, right? An income statement has some, and this is common across any company in the U.S. You have the top line, which is the way the revenue comes in.
Yep.
Then the second line underneath that is the cost of revenue, right?
Yep.
Regardless of what you're doing, it's a cost of revenue. The third line is roughly what is the gross margin, which is the difference
Yep.
between the two. Underneath that is all your operating expenses. And there's anything under the sun could be an operating expense, right? It's
Yeah.
the utilities, it's the
100%. Yes.
cost of software, subscriptions,
Yeah.
offices, you name it, right? And underneath that is obviously your amortization, depreciation, taxes. So a mechanism for how to look at AI is to see what is the value, what part of the income statement you're going to bring value from. Because the
Yeah.
risk with AI, with some of the hype right now, is that there's not enough ability to measure value from how AI is deployed. So we have to be able to first prove value from some of the measures on the income
Yeah.
statement.
Fair
So
enough.
once you're able to sort all of that out, obviously you need a formal technology program, which you may not want to do yourself, right?
Yeah.
Sometimes it's better for us to focus on what we do best and
Yeah.
allow other groups to do what.
Partners to do what they do best. Yeah.
That's right.
Um,
So I would answer your question in those broad ways, but there are certain nuances to factor, especially data and governance,
yeah.
before we make a headlong jump into AI.
Yeah. I have two follow-up questions to that, but before we do that, we have another question from Hitesh. And by the way, Hitesh it's similar to what you talked about, the issue about data and governance. And I think you just want, and it's a good question to go deeper, right?
Yep.
Um, with multiple players like you talked about, right? The vendors, the providers, and insurance, especially even with the ambient listening example that you gave. Who truly owns the data, right? And how is that affecting trust? I'm curious what your thoughts are.
A fantastic question. The look, uh, ultimately, data is, and I might give an answer that may or may not be appreciated fully. It's lot is governed by the laws
Hmm.
and the type of contractual agreements and obligations that we would have. Obviously, there is patient data that patient will legitimately claim they own it, and they are protected with our clients. And there's significant levels of protections available in HIPAA and other regulations that mandate it. Operational data is really owned by the organization managing those operations,
Got it.
right? And then you have publicly available clinical data. Some is public, some is private,
Right.
and then that ownership structure would need to get determined depending on where you're sourcing from. For example, physician data, right? There is a public repository of data available of all physicians, clinicians. So that's more public information. So there is no yes or no answer saying data is owned by X or Y. There are conditionalities, there's contracts, there's regulations that
Yeah.
determine who owns the data.
Do we to just double down on that idea? When you are experimenting with collecting ambient data, do you actually need to ask permission that you're
Yes.
actually recording voice?
Yes,
Right.
absolutely.
Okay.
And even within that context, because of the way HIPAA has rules, you are not expected. So let's look at a hospital. When I went to my primary care about a couple of months back. Anytime they start talking to me, they close the door.
Yeah.
There's a reason for it. It's not to disturb other people because the laws often
Yeah.
require privacy. So let's say a clinician goes to a client's home, and there's an extended family there. She or he have to be careful in opening up ambient listening and starting administering
Yeah.
care while the client or the patient is in front of them and the family is around them. So there
Right.
are nuances, and again, I'm by no means an expert in the laws, right, and compliance regulations, but there are regulations around how you even deploy AI in a
Yeah.
more privatized setting, which goes back candidly to the earlier question about have Medicare and Medicaid and other regulations caught up with this,
Yeah.
and right,
It,
so
it it's such a complex thing because once you start doing care at home, the benefits you have of being in a doctor's office or the hospital, you don't have those issues, right? But you have other issues. Yes, you have the issue, you have the benefit of convenience, but a
right,
whole set of new issues come in, right?
that's right, right.
With other family members being there, access, not having all the equipment. There's a whole host of other things. So it's a fascinating industry.
It
I'm
is.
actually going to go to the next question, which is Janine. Thanks for asking. I'm going to try to summarize this. So Janine wants to know, what do you see opportunities for improving patient outcomes via AI and AI enabled, right? And really around three things: patient care coordination, incenting and tracking patient adoption of recommended interventions, and then calibrating the business value of both.
Right.
Um, are you seeing other companies doing it well? Are you seeing other companies? How are you or other companies taking on that charge?
Most companies are stepping into this field right now. Let's be candid, right? Over the
Yeah,
last 2 to 3 years, this ecosystem is just evolving. So if you look at patient care coordination, um, the the scenario that we just mentioned, right? There's a demand
yeah,
supply imbalance here, and there's a recruitment challenge that we have. So our ability to succeed and provide service to more clients and patients hinges on our ability to automate certain aspects of this workflow in the future intelligently, right? The automation is not just blind automation. It has to be an intelligent automation that allows this to happen.
right,
So the patient outcome or care outcomes also hinges upon our ability to treat and care for more patients. So quantity often has a quality of its own.
yeah.
So
I agree.
that's one way of answering it. The second way of answering it is recommended interventions. You got to be a little bit careful there because of bias coming in. So there are again some regulations and rules of what you can and cannot do in terms of having AI recommend interventions.
Yep,
So I don't think we are, at least in my opinion, we are in a place where we can automatically turn on those levels of AI capabilities in managing interventions. It will
right.
likely happen in the future. It's already happening, right? We have virtual nurses now. We have remote medicine. There are other
Yeah,
things coming online, but where the magic happens between a caregiver and a patient and a client, it's still a very trusted and
yeah.
precious relationship. As a company, as an organization, as a society, we need to figure out if we want AI available in all those areas or not.
I think that's you're absolutely right because there is that trust that you need to recreate in
Right,
every environment, right? And so that makes sense.
right,
Let's go to, I mean, we kind of talked about the art of the possible. We talked about the 5 layers, the different workflows where AI fits into all of these things. We kind of started talking about what are the challenges with data and governance.
yeah,
Um, Let me kind of double click on the challenges as well, right? And
right,
and coming back to what Janine was asking in your answer is that everybody is experimenting and kind of dipping their toes and trying to figure out how to use this. So where is the biggest challenge now? If you think about the different workflows and the use cases, what are companies struggling with? And then Tom, I see a question. I'll get to your question too.
right. That's I think that's a great question for many different reasons. I think the biggest challenge. So there's Mustafa, as you know, right? You have been in this space for a long time as well. There's a lot of hype in AI today,
Yes.
right? And
Yeah.
AI has gone
Separating hype from reality is a full-time job.
right. That's right. And AI is not new to hype. It's gone through several hype cycles in the past as well. The biggest challenge that I think any organization would face, and this is not necessarily restricted to healthcare, it's almost any corporation
Yeah.
seeking to deploy AI, particularly healthcare, of course, is the change management aspect of it,
Yeah.
right?
Totally.
All those processes that have been developed over 15, 20, 30 years,
Yeah.
you cannot just unwind
No.
and plug in AI and expect things to work next day morning.
Yeah.
Doesn't work like that. So figuring out how to change the tires while the car is running is an extremely difficult challenge
Yep.
under any circumstances. So which is why one has to treat agentic AI, especially when applied to enterprise processes, with
Yeah.
a little bit of skepticism. It's not going to be that easy, right? You can fix the data challenges, you can fix the technology challenges, you can build fantastic AI models that will do exactly what is being asked to do, like whether it's prediction, classification, whether it's
Yep.
whatever the outcomes might be. But the issue is how do you apply that into a business context, into a product context,
Yeah.
and make the change happen?
Yeah.
That
And then
is
the adoption piece. You can build a
adoption.
great solution, but then if the clinicians or the patients or the doctors refuse to use it,
Right.
That's a whole different, right? And
Right.
most of the time, that's where technology fails the most, right?
Exactly.
So
That's where technology in general fits. You're right.
yeah,
So
I think that's good. Tom does have a question. Let me get to Tom's question. What are your thoughts on AI in the form of personal robots? Actually, you know what? That's a great question because I was thinking about it too. Because AI and robots are infusing, right?
correct.
To assist with persons in staying at home rather than moving to assisted living facilities.
Yes.
Have you seen any use cases, or is
Yes.
how close or far away are we from this idea?
Oh, wait. So there's a reality right now. So I'll give you a specific use case. If I understand the question right, um, so anyone over the age of 60, 65, depending on their, or even 70 potentially, right? The biggest challenge or biggest causes and reasons for hospitalization is trips and falls,
Yes.
right?
Yeah.
And a small fall can easily lead to a month or 2 month long hospitalization. So now there are CMS mandated codes which allow, and by the way, I should have probably mentioned this in relation to the earlier question. This is one area where I think there is a coverage for deploying, if my information serves me correctly, and I'm happy to stand corrected if not, for deploying mobility enabled AI apps. So what they
Yeah.
do is they put a camera, and as you're sitting in your chair and you try to get up, right?
Yeah.
It tracks the movement of your arms, your legs, your entire posture, and based on the agility with which you are getting up or getting down or laying down on the
Yeah.
floor, it has the ability to predict trips and falls. It has the ability to predict some kind of prognosis of something that is not right
Yeah.
compared to what a normal person like or healthier person who would be getting up
Yeah.
or sitting down on a chair. So just look at the broad range of preventative capabilities, such a AI-enabled mobility tracking system where it just monitors how your hands are moving, how your legs are moving,
Hmm.
how your head is shaping up, and trying to do that gives a physician, a clinician, enough advanced warning of, hey, there might be something going on here. You may want to get a checkup done before
Yeah.
there's a trip and fall. So
Um,
that
and
reminded me, this use case, I just remembered that this is something already in the market coming up.
I think that's great, and that is, it's predictive, so you can actually hopefully take steps to strengthen those muscles, so
Right.
that and through occupational therapy, which is much easier than actually post fall care,
Post fall. That's
right?
right. Right.
Um, and if I had to double down on Tom's question to be a bit more sci-fi, in which you actually had robots at home, right? Because there are companies, at least I know companies in the Bay Area who are experimenting with actually home services robots, not just in healthcare, but just generally deploying robots at home to actually help you. Have you seen anything of that ever? Have
Mhm.
you
I
seen
have
that come through?
no, I have not seen anything like that. Not to say that that's not happening
Yeah.
already. Could be. I have not come across a use case like that.
I know, and not in healthcare, but I've seen cases in which, especially in warehouse and manufacturing,
Yes,
that has
correct.
been a
That's right.
big shift, right?
Right.
Um,
Right.
home
I mean, you
healthcare is
have the
not,
Amazon example, right? You have
yeah,
some Amazon warehouses that are completely automated.
yeah, completely automated. And,
Right.
it's not a natural form of what we think about a robot in a humanoid form, but they are robots who are actually basically doing the
That's right.
work. Ravi, we are almost out of time, so I'm going to ask you one more question in our last minute. And I love to ask this question to all my guests: is personally, how are you using AI today? Like, what is your favorite hack that you want to share with us?
Sure. I came to know of this hack earlier this year, and it opened my eyes. It's nothing fancy. Whether you use, I use two. I use ChatGPT. I use Perplexity,
Mm-hmm.
and you can literally ask AI. Can give either of those platforms or any others entire problem statement,
Yeah,
and you can ask the platform how to prompt it as well.
yeah,
So it'll literally tell you how to define the prompting based on the problem statement you have provided. So
yes,
you don't even have to think at this
yeah,
point, right? It's going to literally do everything for you. And once I
yes,
started using that, I was like blown away. My God, you don't even have to get too smart with prompt engineering anymore. it'll tell you how to prompt itself.
Yeah,
Um,
it does. It's amazing. Yeah.
it's amazing. It's just that
And
blew my mind.
the other use case I have is usually I have a prompt and I have a specific way in which I write my prompts. Then
Yeah,
I'll put it into any of the large language models and then I'll ask them how I can make it better,
yeah.
right?
There you
Or
go.
you can do reverse engineering, which is what you were talking about, in which if I go into a long chat and I like what it has,
Yeah,
and I say, you know what, I want to repeat this chat for something else,
right,
tell me the prompt,
right.
and it will do that. So there's yes, the use cases are unlimited.
Unlimited. Oh
Um,
yeah, that's right.
this is great, Ravi. We're almost out of time. Thank you all for joining. Great questions from Hitesh, Janine, and Tom. We appreciate it, and thank you all for joining. This is great, Ravi. We should. I apologize. We should do this again, maybe a year from now, to see how things have changed.
Sure,
Yeah,
absolutely. We'd love to. Thank you, Mustafa.
perfect. Um, and for the rest of the folks, have a great Friday evening. Yeah, or Friday afternoon, wherever you are.